George Kilpatrick, Inspiration for the Nation, celebrating people we feel good about. We have a distinguished service professor and the chair of geriatrics at Upstate Medical University, Dr. Sharon Brangman. And she's here to tell us or share with us what we do now. So many of us have gotten the vaccine. Many of us have gotten our second dosage. New York State is opening up more opportunities for more people to get vaccinated. So, Dr. Sharon Brangman, can I tell you how many times I've said, because Dr. Sharon Brangman told me it was okay. No, seriously, if we going out together.
I won't let that happen, George.
No. I said, listen, Dr. I trust this sister. She knows about all the studies and all of that. And she said it was all right. And I've been telling people that. So here you are again. And this is Dr. Sharon Brangman. This is the one I've been telling you, who I've been listening to. And I said, if she says it's all right, she's all right. So let's talk about where we are now with the vaccine. Now, at the time we talked, Johnson & Johnson had not been approved yet. So since we've talked, Johnson & Johnson has been approved. It's been distributed. People are getting vaccinated. So just where are we now in your view?
So yeah, thanks for having me, George. Things are fast moving. So we now have 3 vaccines to choose from: Pfizer and Moderna, which both require 2 shots, and Johnson & Johnson, which is a 1-dose, one and done vaccine. After your second dose of either Pfizer or Moderna, you have to wait about 2 weeks to be fully protected. And after your Johnson & Johnson, you're fully protected after your first dose in about 2 weeks.
Mm-hmm.
So once you're fully protected, then you can start to visit people and take back some of the privileges we had to give up because of the pandemic. And I understand that everyone is sick of this pandemic.
Yes.
But it's important to remember that the pandemic is not over yet. We still have a lot of virus circulating out there, and we're particularly concerned about those variants. Whenever the virus has a chance to multiply, it can always tweak itself to turn into a variant.
Mm-hmm.
So we still have to be cautious. So two weeks after the Moderna or Pfizer, your second dose, or 2 weeks after your 1 shot of Johnson & Johnson, you can start to gather with small groups. You can gather with unvaccinated people who are from one household. I wouldn't go out in crowds. I would still avoid medium to large crowds. And I would still try to focus activities outdoors whenever possible.
Mm-hmm.
Whenever you're indoors and you're sharing air with someone, and especially if it's not well ventilated and you're not sure about the filter system, that can pose a risk. And I do know some people who have tested positive after being fully vaccinated.
Yeah, we had a senator or assemblyman, I can't remember which one, here in New York that happened. They got the COVID after, like, I know 2 people, right? One person got COVID after the Johnson & Johnson shot. Another one got COVID after the first dosage of whatever vaccine they got.
Exactly. So these are not 100% protection. They're very good, but they're not 100% protection.
And here's what the guy said to me who got COVID after he said, but you know what? I didn't go to the hospital. I was able to get through it. So speak to that, because that's where a lot of people are like, well, why am I getting it if I'm still going to get COVID?
Oh, that's a very important point. All of these vaccines will keep you from getting severe COVID. They will keep you out of the hospital. It'll keep you out of the ICU, and it'll keep you from dying.
Mm-hmm.
So that's the important thing, is taking these vaccines will keep you alive.
Yeah.
It doesn't give you full protection. In some cases, people are still getting positive, but even when they are, their symptoms are much milder than they would be than if they were not vaccinated.
Now, both you and I have had 2 doses, so we should still, but here's the thing. we should still mask up. We should still do all of the recommended social distancing, even if we are vaccinated. Why is that important?
Well, because we are still waiting for information about whether or not, even if we're fully vaccinated, if we can still infect others.
Mm-hmm.
So especially if you are around people who you know are high risk and maybe they haven't been vaccinated yet, you should be very careful. Hopefully we'll have some more information about that shortly. The other thing is that these variants are circulating. And we don't know yet how well the vaccines do against the variants. Preliminary information suggests that it is helpful.
Mm-hmm.
However, there's the variant from South Africa and the variant from Brazil that we're not sure how well we'll get vaccine protection. So I know everyone is tired, but there's still a lot of virus circulating. And people say, oh, I want to travel. I haven't been out of New York State for a year. Well, the CDC still is not recommending that we do travel either, around the United States or to other countries. And in fact, you don't want to go to a place that has a very high infection rate right now. There are several states where the infection rate is very high.
Yeah, and I think for some of us, basically taking caution to the wind, because you got to make sure that if you are traveling, a lot of people are this week because or have traveled this week or traveling next week. Obviously you've got to be very, very extra careful. Not that you would advise even going anywhere, but you got to be extra, 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 extra careful.
So that's exactly right. And people are going to do what they're going to do, but then you have to figure out the safest way to do it to minimize risk. And you wouldn't want to do a bunch of really risky things all at once. So if you're going to travel and then you're going to go eat in a crowded restaurant and then you're going to go to some other big indoor activity, that's really increasing your risk rate.
And you talk about the outdoors is better. Why is that? Because of the ability to social distance or because of the air circulation? What is it about outdoors that gives you a little bit better sense of it?
So when you're outdoors, those little droplets can disperse easily, especially if it's a little bit of a windy day. The best ventilation is outdoors with a slightly windy day because that moves those droplets away before they can settle in and infect someone. You don't have that option indoors because the droplets can stay in the room and circulate around.
Now we live in a community where the weather changes often. And so, because at first it was believed that was it the warm climate burned it off? We had a lot of theories back right when it first started.
There was a certain president who had that theory.
Oh, okay. All right. The warm weather would not support the virus, but not so, because we see what's happening in other parts of the country where there is plenty of sunshine and plenty of COVID. But a lot of that has to do with people gathering. And I think it was someplace, was it Miami, where it was sort of like a state of emergency, not a state of emergency, but alarming that the kids were gathering in such numbers that they've really had to take a look at that. So I thought it was important for you to come on because, again, many of us are getting the shot. There are still people who are saying, I'm waiting to see what's going to happen with other people before I get it, because I want to make sure. And so that is something that some people are doing.
Well, now New York State is allowing all adults to get the vaccine. And we have a lot of young adults, 20s and 30s, who feel invincible because, the virus clearly was impacting older adults. Right. However, the people now who are getting sick and dying are the 20 and 30-year-olds. So yeah. I don't think they should take this for granted.
I got a call from a family member who was like, so we had two situations. My mom passed from COVID, and then there was another person who had it and didn't pass thankfully, right? And one went to the hospital and one walked out of the hospital. Okay. The one who walked out of the hospital is still walking around. The one who stayed in the hospital passed away, fueling the theory that the hospital was the place that, you know, I mean, I don't want to, I shouldn't even be talking about it in this way because I'm talking about my own family, but the idea that because I went to the hospital, because you went to the hospital, that signed your ticket, because a lot of people didn't come home.
So it's not the hospital per se, it was that you were so sick that you needed the hospital.
Mhm.
So people who are able to walk around, they were probably able to maintain their oxygen levels and they didn't have very high fevers and they were still able to eat and drink and talk.
Mhm.
But people who got very sick, who couldn't breathe, they needed to go to the hospital. So the hospital didn't do it. It was how severe their illness was. And the other thing to remember is that not everybody dies from it, but we're starting to see people now who are long haulers. They have a lot of symptoms that just don't go away. And I recently read an article about people who had very mild infections who now, several months later, are having bad side effects. They have extreme fatigue. They can't walk up a flight of stairs. And these are young people without getting very short of breath. They have headaches. So we think of this as death as the ultimate, which in many ways it is. But there are people who survive COVID who never regain their healthy lifestyle.
You know, Dr. Brangman, I'm just going to be a little bit vulnerable here because when I think about what happened to my mom and I think about the conversations we were having, and she was not on a ventilator, you know, we were making plans for her to leave, and it changed that drastically. And I know you're not ethically allowed to comment on another case that you haven't read the chart on, got that. But you see where can you just, generally speaking, how does that happen?
So that has been described a lot. And what is happening is, in many cases, people's oxygen levels are going down slowly and they start to breathe faster and faster to try to keep up with it. So I've heard many stories about people who 1 minute were on their cell phone texting and the next minute they were unconscious.
Mm.
So that can happen very suddenly. The other thing is that some people with COVID get a lot of blood clots. And you can get a blood clot that can suddenly break off and travel to your lungs or to your brain or something and change you within seconds. So it's very hard for us to see someone who's talking and seems okay 1 minute and then they're not okay the next minute.
So many of us, right?
Yeah,
Yeah.
right. We try to make sense of it. And there are a lot of things that happen in the medical world that it can be hard to make sense of, but we know that they happen.
Yes, they do. Thank you for allowing me to understand that, because I think that's where we are. So now we have this new thing going on. There's the I don't know, the vaccine truthers or whatever they are, like they're just not going to do it. And oh, the vaccine passport. That's the other thing. I forget about the truthers. They can do what they want to do. That is a thing that's got, okay, Dr. Sharon Brangman, here we go again. What do you say about this passport? I need to know.
So everybody's concerned about privacy, but if you have a cell phone, they already know where you are. So
Right.
I try to keep it.
You know what somebody told me? Amazon got more information in the state of New York.
Exactly. Amazon tells me what I bought and when. I get in my car and it automatically tells me the best route, like they know where I'm going. So, and if you
That's
have a
where you're going, right? They guess. They're like, oh, if you're going over here, this is how long it's going to take you. So how you know where I'm going?
Exactly. Sometimes I just go in the opposite direction to confuse them.
I don't know.
But your cell phone gives out a little ping so you could be tracked wherever you are. So I understand privacy concerns, but I think it's already gone. They're doing facial recognition now so that you can get on a plane without a boarding pass.
Okay.
So they're going to have your face in a data bank somewhere. I think that this is going to be a new world. There's going to be a new normal. There are going to be many things that are different. I read an article that said business travel may decrease as much as 30%. because
Yeah.
businesses now realize they don't have to do as much travel to get work done. People
Right.
may not be working from big offices, you know, there's big offices that buildings that may be vacant.
I look at New York City and I wonder what the heck is going to happen because, you know, all these skyscrapers and people don't have to be there.
They don't have to be there. So we're going to have a new normal. There has never been a pandemic that hasn't changed us permanently. And now we're going to see. It's going to affect, it's already affecting education. It's affecting healthcare because now people can talk to their doctor on their computers, right?
Right.
It's affecting business. It's affecting real estate. People were moving out of little apartments to buy houses so they can have more space. So this is going to be a lot of change, and we're going to have to see where it goes.
Here's the thing though, with medicine, I'm glad you talked about how it's changing medicine. If I've got something that I could tell you about and we're on the computer, that's fine. But if you can't feel the lump or the thing or the what, or to look down my throat and see the thing in my ear, to see the thing, you know what I mean? Like for certain things, if I tell you what's going on and you keep asking me all these questions, I can get that, right? But the things that you got to touch, tactile, you know, medicine is also about that too. What about the impact of
That's a very good point. And developing a trusting relationship with a patient can be harder to do over a computer because we all are creatures that need that personal touch.
yeah.
And there are some conditions that you do have to physically examine a person. So it's not going to be useful for everyone all the time, but it does offer us another way of taking care of people.
So do you think we're going about it the right way in New York? I mean, there's pressure, right? So there's the twin pressures, the pressure of health and safety and the pressure of opening for commerce. So how do we balance the two of those things?
So that's the big tension. And I think that in New York, we're watching very closely, and there have been warnings that we'll pull back if we see the rates spike. So we are not as extreme as other states where they totally abandoned the masking, the mandatory masking, and totally opened up everything 100%. I think that was too quick and too fast.
What do we have? What is that? Maryland, Alabama, Texas, I believe so far.
Sure. And we are seeing infection rates increase. So you can't go from 0 to 60 and suddenly open everything up and throw your masks away. Believe me, I understand that temptation because this has been a long haul, but we have to ease up off the gas pedal.
Yeah.
And watch it very carefully.
Schools opening here in, you know, in a week or a couple of weeks, right? Fully open 5 days a week. CDC says 3 feet, not only 3 feet is without a barrier is okay. And so medically, does that is well, that's coming from the CDC. So I guess that's science saying it's okay. So what do you make of that?
So we're learning about this virus as we go. And we're starting to understand that children don't manifest it the same way. And so I think that was the basis of these new guidelines. We also realize that school is an essential activity. A lot of children have not done well this past year. And it's very hard for parents to work and also supervise schooling. And if we are going to open up, if the children are not in school, that's going to be an issue. So I think making sure it's as safe as possible. As you know, right now, the vaccines are not recommended for people under the age of 16. And there are a number of studies going on looking at the vaccine in children. We anticipate that it'll probably be okay, but we don't have that information yet.
Dr. Brangman, is there anything that isn't right in front of us that we should know about? Because what my thought about this segment was, now that we have the vaccine, now what, right? So part of what I'm hearing you say is business as usual in terms of keep masking, keep washing, keep social distancing, even if you're vaccinated, with some modifications. If you want to hang out with other people who are vaccinated or from your pod or from their pod, right? We've got that. I went back to church. I trust that my church is properly ventilating. I know some people are still, but they've got it all down. Your temperature, you're washing, you're socially distanced. You can't all. So we're doing what I think. I tell my people, I said, look, we've got. I'm talking about Bethany. You know, they've got it in a way that I think that's safe for everybody. But what is there anything we're missing here in this conversation?
No, I think that's the smart approach. This virus is not going to totally disappear, so we do have to live with it.
Yeah.
But what we want to do is reduce the risk as much as possible. It may be impossible to get the risk to zero. But certainly if the virus is spiking in an area, then we have to step back and wait for it to calm down again. All of the things that you mentioned, such as ventilation, masking, hand washing, avoiding large gatherings, I'm sure that's something that churches are looking at. There's a lot of people that really miss going to those activities. But we can't go back to the old days where people were totally crowded in. Everybody is hot and singing and coughing. You know how theaters are. Those are other areas where, you know, we all love going to see shows. They're going to have to think of ways to do it safely. This virus it's not going to just disappear. We have to learn to live with it.
Yeah, I know you say that. And I think one of the other pieces is we don't even know if we're going to need a shot next year. We still don't know that. So, but what you're saying to me, and you're saying to all of us, at least in this moment, if you can get the vaccine, not if you can get it, the vaccine is available, get it, because we can reduce the risk. That's what this Dr. Brangman here, this is the one I've been telling y'all about. I said, I trust Dr. Brangman because she's gonna tell me if it's wrong or right. So I trust her.
And we want to reduce the amount of virus that's circulating, because every time it finds a landing spot, it can change a little bit and create a vaccine that's tougher to get, a virus that's tougher to get rid of. So we want to reduce the amount that's floating around. We want those numbers to come down. They're still too high. So the pandemic is not over. And we still have very high rates in Europe, in India, in Brazil. A lot of countries are still struggling. If they still have the virus, we have the virus. If there's one thing this virus has taught us, is that we're all connected. So someone can take a plane and be in Brazil in a number of hours and vice versa. And we could be anywhere in the world in a few hours. And if they are still in the middle of the pandemic, then we can still have the pandemic.
One of the things we should also point out is that because we're doing all of these things, we reduce flu, right? I barely hear flu.
Right.
Because we did all these
very true. So we might be into a new thing now.
Yeah.
Best way to reduce flu is during flu season. Mask up, wash your hands,
and keep your distance.
Stay away from people who are coughing.
And you know what? Last thing, I keep saying, you know what, because you're so engaging. The last thing is this. Remember when you went to work coughing, sneezing, because that's what was expected of you. And if you didn't do it, you were somehow not tough enough. Go get you some Robitussin and suck it up. That's what the attitude was. Now, keep your behind home.
Yes, if you are coughing, we don't want to see you.
We don't want to see you. Well, Dr. Sharon Brangman, Department Chair of Geriatrics, not Department Chair, the Chair of Geriatrics at Upstate Medical University, and a whole lot of other titles. She gave me permission not to use the 7 titles that she had. They all start with chair of, chief of, chair of, chief of. But this is a bad system. We thank you, Dr. Brangman. Please come back and keep us updated on what we should know. Consider this your outlet to get the word out. Appreciate you.
Sure, George. Thanks very much.
Inspiration for the nation.